Hello, my name is Sam Taylor. I'm working in communications with MSF and I'm here in Mubende in Uganda, which is the epicenter of the Ebola outbreak that was declared on September the 20th. For several weeks now, MSF has been working closely with the Ministry of Health to prevent the spread of the virus and to treat patients who get infected. I'm here at one of our Ebola treatment centres that is very nearly completed. It's a 39-bed facility in Mubende and I'm here to show you around. So as patients come in, they're going to be screened by MSF staff in this facility here. You can see that they will be kept at a 2-metre distance, so our staff can assess them and see potentially how infectious they might be. So Ebola is spread through bodily fluids, so we need to protect our staff and ourselves at all times when we're around patients who are Ebola positive. So as we come into the ward here, this will be for suspect patients and they will be tested. The testing takes around 6 to 24 hours to come back, and once we know if they're negative or positive, we will act accordingly. So each of these tents that you can see over here has 8 beds in it. This is important for patient privacy, but also infection control. Also important for infection control, you can see here the taps on the ground. The white tap is for patients to clean themselves. The red tap contains chlorinated water for our teams to clean equipment, and so on. Ebola can be killed by chlorine, and soap and water and washing hands. It's really a virus that's not that difficult to kill, but once people are infected, there is unfortunately no treatment and no vaccine at the moment. In terms of the facilities here, you can see here the 8-bed suspected patient ward. Four rooms down this side, 4 rooms on the right hand side, and each of the rooms has obviously electricity, it has a bed, it has a PowerPoint. This is important for patients to be able to contact their families. Moving around in this direction, you can see at the end of the tent ward here, our donning area. Now, when it comes to Ebola, safety of staff, all staff, is absolutely key. So in this donning area that you see ahead of me here, our staff, on top of their smocks, they're going to put a coverall, they're going to put a hood, they're going to put a pair of goggles, they're going to put 2 pairs of gloves, and they're going to be wearing rubber Wellington boots. You see the storage area in front of me here. It takes about 5 minutes. You really need to practice and you need to make sure that there's no skin at all left exposed, because we want to keep the virus inside the Ebola Treatment Centre. The 2 walkways that you can see there will allow family members to come and talk to patients and come and interact with them and check that they're all right, and we can show them what the treatments are that are going on. So that's very important for the treatment of Ebola. Over here we have the doffing tent. Now, doffing is just as important as donning. Doffing means taking off the personal protective equipment. We will take about 15 minutes to do that, and the hygienists, the MSF hygienists, will help our staff members take the equipment off, and they have to be sprayed down again with a chlorine solution. The rubber boots, the goggles, the heavy-duty gloves can all be washed and reused, but everything else has to be burned because it's been in the infectious zone. Now, in terms of staffing, we've had 290 construction workers here for more than 3 weeks. They've been working day and night. MSF teams have been working round the clock to set up this facility because we are at quite a critical stage of the outbreak now. Once it's fully staffed, we'll have around 170 people. That's going to be around 15 doctors, around 50 nurses, 15 hygienists, mental health workers and counsellors, and around 50 or 60 hygienists. Now, the hygienist's job is really important. They're the ones that have to clean all the equipment, they have to clean everything inside the wards, they have to work with the patients to keep everything chlorinated and scrubbed down as much as possible, because as I said, chlorine will kill the virus. So that's a really important job, and they need a lot of training for that. Now, as we move through the site here, you can see ahead of me the wooden building, which is going to be our intensive care unit. So if the patients test positive, they're going to go from the negative area that we were just in to the positive area, which is just ahead of us here. There's no difference in the level of treatment that we can offer. We offer treatment for typhoid, for malaria, for co-infections. We offer hydration. But as I said, unfortunately, at the moment, there is no treatment for this strain of Ebola, and there is no vaccine for this strain of Ebola. So up ahead is the intensive care unit. Now, the key thing about this unit is it's going to be very visible, both for patients and their members of the family, but also for our medical staff. Why is this important? Well, it means that we're going to be able to monitor their progress and keep a very close eye on them without necessarily having to put on and take off the PPE, the personal protective equipment, which is very time consuming and as I said, costly. So you can see in the structure ahead of me, we're going to have plexiglass windows on the outside, which will allow patients to interact again with their families. And also, as we come round into the centre of the intensive care unit, you can see all along this corridor there will be plexiglass windows in each of these spaces, which will allow doctors and nurses to monitor the progress of the patient. Now, at the end here, we're going to be installing something that's called a cube. A cube is a new innovation made by an NGO called Alima. It's a one-person unit made from transparent plastic that will allow the patient to be observed and interact with our doctors and nurses at all times. They should be able to treat them from outside the cube, which again gives good access to the patient. So what you can see in front of me is the happy shower. And this is where once an Ebola patient has turned negative, they get themselves thoroughly cleaned, they're given a package to go home with, they get counselling, and then off they go back to their communities. I think that's something that we all want to see, is these Ebola positive patients getting back to their normal lives.